So this is the Thermacore. The supplies for this come in a really big white box. When you get the machine, it's going to come with this cartridge guard over top. And you'll see when we take it off that it's just foam on the back, but it's really meant to protect the mechanism. So it's important, do not lose this. Put this somewhere where you're going to remember it, where your friend's not going to come by and throw it away while they're trying to clean for you. You got to save this because when you're finished, you're going to put it right back on the machine. All right, so we're going to get our tubing. Sorry, it's a little messy. So this actually comes in 3 parts when you pull it out of the box. You're going to have your cartridge cassette. You're going to have your upper tubing, which when you look at it,
I can offer a hand too here.
Thank you.
How should I hold that?
That's
there
perfect.
We go.
And we'll put it there. So this is yellow to yellow, and you'll see this when the tubings aren't connected. This is blue to blue, and then this is your lower tubing, which is the 3rd component, and this is red to red. So you'll grab a liter of saline to prime with, and then to lock the cartridge in, watch out, it's really wet. If you see, there's this lower ridge here. Okay, so you're going to take that, and with the handle in the 6 o'clock position, you are going to clip that ridge into this lower metal piece. So you'll kind of push down. You won't have this problem with the tubing. Sorry, I got you wet. So you'll push down and then push up into this chamber, and you're going to pull all the way until it's locked. All right. Now, one really important thing to do is to make sure that you get this tubing seated far enough back where these little teeth aren't going to puncture it. There's a little tooth right here. So it's got to be back behind that, and then you'll close this chamber.
Okay. And then also, if it's too far, you also might run into issues.
Yes, if it's pushed too far back, there's rollers back here that it could get caught into. So it's probably seated maybe 70% of the way back to the back. But the teeth are usually where people have issues, more so than the rollers. Okay, so we've done that. We're going to plug our machine in and we're going to turn it on. So we're going to press and hold the on button. Okay. So we've primed this 100 times already, so it won't look like what it will in reality. But basically, you want to start with a bag of saline on your longest tubing here. You've got 2 other spikes, which are great for your blood products. You don't have to pre-prime these because you have this nice little chamber here that's going to collect any extra air from the top of the system and vent it out through this port. One of the cardinal sins of using the Thermacore is getting this vent wet. As soon as this piece is wet, your system won't run appropriately. It'll give you a lot of issues. So make sure that you don't flip this upside down to get this wet, that you don't drip things on here. You want to keep this as dry as possible.
And filling, you need to be above the white, but you want to have a comfortable distance then between.
Correct.
That way even this top part of the vent doesn't get.
Yeah. So when you prime, you're going to prime above this inner piece here, but not so far up where you would risk getting this wet. Exactly. Okay. So to prime, we're going to make sure that all of our clamps are open. We're still not attached to our patient, and we'll just stick this clamp as distal as possible. All right, and so then all we do is we press and hold the prime button. And we're clamped up here. So it's now priming. And it's yelling at me just because of the way we have it. So we'll recirculate it through here. So that's priming. You have a couple of options when you program this. You can run it slow, so you can run it in mLs per hour, which is nice if you are sort of nearing the end of your MTP and you just kind of want to finish off a little bit of fluid over a slower rate. Generally, I just set it to rapid, and this will default to running 500 mLs per minute. You can adjust and drop it down over here if you don't want to do as much. Say maybe you want to run it at 300 mLs per minute. so a unit of blood in per minute, but 500 is the default.
What lines can you not, like, at what point is it too fast for like a peripheral or a midline or central?
So you can run through a peripheral. 18 or bigger would be great. If you use a peripheral, make sure you take off any Y connector tubing or lure lock caps, because that will slow down the rate at which you can run. This machine is actually fairly intelligent, and so it will tell you if, say you hook this up to a 20 gauge catheter, it'll tell you if it's sensing too much pressure where it's not running appropriately. Mm-hmm. And you can actually change the pressure sensitivity on here. Mm-hmm. So it's set to set the max pressure at 300 milligrams of mercury. You could drop it to 100 if you felt like your access was such where you had kind of puny peripherals and you didn't have a central line and you were worried about that. But generally, 2 18 gauge IVs would be a great place to start. If you really need to MTP someone and they only have 22s or whatever it is, then you should talk with your team about getting in a femoral central line emergently. So you can set the pressure there, you can run it in, and all you do is you hit the setting you want, so rapid, and hit start, and it'll start to run. Oh, of course, we're sort of out of fluid now. So that's basically how the Thermacore works. It is good for 4 hours or 4 coolers of blood, whatever comes first. You can run packed cells, FFP, or crystalloid through here. You don't have to change the system if you've gone from packed cells to FFP. I will every once in a while flush it through with just a little bit of crystalloid. Sometimes things get a little sludgy or murky in this chamber, and so I just like to do that. I don't know that there's really any indication for that. It's just my preference. This will run if it's not plugged in. It will not heat, though, so it does have battery life if you're going to transport to the OR. You could continue to infuse. You just won't be able to heat the products you give. Go ahead.
Do you know how much battery life?
I don't actually know how long it runs for. Long enough to make a trip down to the OR. I would still bring some pressure bags and, backup supplies with you. If it's giving you problems, and let's say you've just spiked 2 new products and you don't want to lose that volume, you can actually flip it back into the loading position, so at the 6 o'clock position, and it will essentially open the system up to just be regular large bore tubing. So you could then pressure bag in what you had left on the system itself. Okay. A lot of times this one gives us some troubleshooting issues. Like I said, if the vent gets wet, sometimes the cartridge cracks if you haven't loaded it properly. Again, you can puncture this tubing with the teeth. So we always have a backup rapid transfuser, which is the level 1, which is the system here.